I'm Dr. Linda Ehlers, and I'm a chiropractic physician. You know, here in Illinois, chiropractic physicians are charged with the responsibility to treat human ailments without the use of drugs or operative surgery. I hold my medical colleagues in their mastery of pharmaceutical drugs and surgery in great esteem. That's their specialty, and they are the ones you must see when you have questions and need answers about the use of drugs and surgery. But this presentation is not about drugs and surgery. This presentation is about why my office is different than every other doctor you've tried. So what makes me different from every other doctor that you've seen? I treat my patients metabolically and neurologically. You're watching this because you or someone you love is suffering from a chronic health condition. I'm here to tell you that no stone is left unturned to determine what the exact cause of your condition is. So how do I successfully treat my patients? Well, first by using very specific metabolic and neurologic testing and specific metabolic and neurologic treatments. Our metabolic treatments are based on specific laboratory studies done by nationally known and respected laboratories like LabCorp, one of the largest blood testing laboratories in America, and by Cyrex Labs, founded by Dr. Vojdani. He's the author of dozens of scientific studies on gut health and nutrition. We also do this by using specific blood tests, such as the thyroid panel, and not just a TSH and T4. That's not good enough when you don't feel well. We also do complete metabolic panels, which can include up to 14 different tests, lipid panels. We will do a complete blood chemistry with an automated differential, paying attention to the different white blood cells in your system. I can assess your thyroid, your adrenal glands, your liver, your kidney, your red and white blood cell health, and your gut function with these tests. All the internal functions can be affected with a chronic health condition. So by addressing any problem with your thyroid, your adrenal glands, your blood chemistry, your gut function, I can help you to heal faster. The complete metabolic panel also allows me to check your blood glucose levels, because too much or too little glucose can be disastrous for your body, and because glucose and oxygen are needed by the brain to function properly. And I test your hemoglobin A1C levels to make sure that your glucose levels have been well controlled in the preceding 3 months. We also do food sensitivity testing, and that's done through the blood. And it's done to determine if you have a sensitivity to things like gluten, which is a compound found in wheat, rye, oats, and barley. Also sensitivity to milk, eggs, yeast, and soy. If you're sensitive to any of these food groups, it is making your condition worse. If you have the following symptoms, you could be suffering from sensitivity to gluten, to soy, to milk, to eggs, and or yeast. Here are some of the symptoms of these sensitivities. Chronic pain or fatigue, frequent indigestion, bloating after eating, frequent loose bowel movements, or the opposite, constipation, mouth ulcers or sores, and sometimes even vomiting. And the only way to find out if you're suffering from any of these food sensitivities is to run the tests. We also will look at your adrenal glands. They're an important part of your endocrine system. You can test your adrenal glands with a test called the Adrenal Stress Index. It's a salivary test, much like the DNA testing. Your adrenal glands are your stress organs, meaning that they react to stress. If you've been or are under stress now, this test is a must. If you suffer from insomnia or blood sugar issues, this test is a must to measure your cortisol levels. When your body's cortisol levels are abnormal, you will suffer from insomnia and or problems with your blood sugar. Cortisol levels can be corrected, and they can be corrected with specific nutritional protocols. You know, your condition could be caused by or worsened by an abnormally functioning stomach. Whether it's too much acid or too little, if your stomach isn't working properly, your food may go into your body, but it will not get into your cells. And if your cells aren't properly nourished, then they don't work properly. And you end up feeling sick or worse. I can also run tests for H. pylori bacteria to determine any problems related to this particular microorganism's infection of the stomach and bowel. I'll also test for intestinal permeability if that's important and appropriate, and that's done to determine if the patient suffers from leaky gut syndrome. Leaky gut syndrome is a condition where the lining of the bowel is altered or damaged, and that's caused by antibiotics, toxins, poor diet, parasites, or infection, and that can lead to increased permeability. That means the gut wall is permeable to toxins, microbes, undigested food waste, or larger than normal macromolecules. It's been proposed that these substances affect the body directly. Some others postulate an immune reaction to these substances. I also can test for brain neurotransmitter levels. Neurotransmitters are vital for proper brain function. Decreased neurotransmitters can cause increased pain. I can also check hormone panels, and we do that to determine if the patient suffers from low testosterone in males or low estrogen and progesterone levels in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sometimes we call them personal summers, sweating attacks, weight gain, and decreased physical stamina. And finally, I may need to test for inflammation in your system, and we do that by testing homocysteine levels and C-reactive protein. Many people suffer from chronic health conditions are actually suffering from an inflammatory process. In fact, just about every fibromyalgia patient that I've treated suffers from some form of chronic inflammatory process. I also use neurological treatments based on very specific neurologic testing. First of all, let me tell you that oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive. One is fuel, and one is activation. Fuel comes in the form of oxygen and glucose. We're not worried about your glucose levels, but we are about your oxygen. We know by using oxygen, I can help you feel faster. By using exercise with oxygen therapy, I can increase firing to the brain. By increasing firing to the brain, we help many chronic conditions. We also treat with brain-based therapy, and the science of neurology has given me many tools to help the brain regain healthy control of the body. I use specific brain-based therapies such as vibration therapy, which causes the body to fire information into the back part of the brain, called the cerebellum. It's this part here. When one of the functions of the cerebellum is to control spinal muscles. Do you think that might relate to back pain? I may also use auditory, visual, olfactory, and caloric stimulation, all of which are designed to increase firing of the brain and restore normal function and control. I have a Solaris 709 cold laser here in the office, and cold laser therapy helps heal tissues faster. We also have a non-surgical spinal decompression unit. What it does is it creates a negative pressure on the disc and helps to remove pressure off the nerve. It also provides a slow stretch of the muscles, which causes a firing up the spinal cord, which increases the firing of the brain, which increases the body's ability to heal. I may also use rhythm and music-based treatments that use visual, auditory, and motor stimulation to increase firing of the brain. As I mentioned, I also use very specific metabolic treatments. My recommendations for nutritional therapies are based on protocols developed through science-based nutrition. For example, if I make a recommendation to you to use vitamin E, it's because I have over 700 scientific research articles discussing when, how, and why vitamin E should be used. One of the cutting-edge treatments that I also employ is glutathione in all of our treatments for chronic conditions. Of course, along with other nutritional protocols, glutathione is the mother lode of antioxidants. Glutathione cannot be taken orally. You can't take it in pill form. The body will not absorb it. So let me tell you, I've seen miraculous changes in our patient population as a result of these specific glutathione protocols. So once I've run the necessary tests to determine your specific condition, I can successfully treat you with the proper neurologic and all-natural nutritional protocols. I want you to ask yourself the following questions. How has your chronic condition affected your job, your relationships, your finances, your family, and the other activities in your life? What's it cost you in time, money, happiness, sleep. Where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? And what is it worth to you if we could improve your condition? I want to help. So I'm offering you 2 free visits to see if you are a candidate for care in my office. This offer is only for those of you that have actually watched this program. I do not accept all cases. I only accept those cases that I truly feel that I can help. If you would like to schedule your 2 free visits, call my office at 708-598-9010 and speak to my staff. They'll get you an appointment as soon as possible. Again, the office number is 708-598-9010. Thank you.